Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today we have two guests, going a little different than our one guest, but it's going to be more fun, I guess, this way. So this will be great. We're here with James Sutcliffe, the CEO at Veta Health, and Tanvi Vattikuti-Abbhi, the co-founder and chief strategy officer of the company. Thank you both for joining me today.
Yeah, thanks for having us. I appreciate it.
Absolutely. Excited to chat. Well, how we usually like to start things out is, James, it'd be great to get a quick snapshot of your background, and then Tanvi, it'd be great to do the same for you, and then we can talk more about the company and really what you're focusing on. And I have a couple other questions here that I'm really curious about asking you as well.
Sure. So quick snapshot of my background. I've been in various facets of healthcare for the better part of 23 years. But more exclusively focused in this virtual care, digital care, telemedicine, whatever you want to term it, space for a little over a decade now. I've worked with lots of different organizations, from high acuity episodes of care in emergency room environments and disparate networks to direct consumer environments and kind of everything in between. And excited to be part of the Veta Health organization now.
And I'm Tanvi. I am one of the two co-founders of Veta Health, and I came to healthcare from a bit more of an unusual background. My background is in the social impact space, where I worked primarily in emerging markets, helping to seed and grow companies that take a double or triple bottom line approach. And when we started Veta Health, it was clear that there was so much opportunity to impact the patient experience and really generate better, not only experiences for patients, but ultimately health outcomes using technology and using business in that sense. And so Veta Health was really born out of a simple idea that we can better empower patients in their care experiences in the 90% of time that they're spending outside of a traditional care setting.
Thank you so much, by the way, for the intros, both of you, and the snapshot of Veta Health. I had a few things that I really wanted to kind of lean in on today. And the goal is, by the way, to have one or both of you back on in the near future, because we try to keep these things nice and short and sweet for our listeners. So there's only so much we can go through. So love to have you on again in the near future. I want to talk a little bit about this, basically, I guess, transition or James, right? You're the CEO. Can we talk a little bit about how that, I guess, came to be at the company? I'm really curious.
So, I mean, as far as the transition for me joining this organization, the reason behind it is, I think some of the things that I've worked through from an experience standpoint and predominantly focused in the commercialization efforts, or taking organizations from one phase to their next phase from an evolutionary standpoint, is something that I've developed a great expertise in. Tanvi and Nora, as co-founders in this organization, have spent the better part of 5 years really building something substantially meaningful and really, really relevant in this space. And we're looking for someone who can help with lifting it up into recognition and really planting the flag from a market share and marketplace awareness perspective. So I think I bring that experience that is something that can help accentuate the processes that have already been developed and really further their advancement.
And I guess, Tanvi, from your point of view, what was it that made, so it seemed like it was a great fit for James to join. What was it on your end that's like, yeah, we want to be able to work with James, we want a new CEO?
So we were really excited to have James join our organization a couple of months ago for many of the reasons that he just outlined, particularly with a really kind of strong and depth of experience in the commercialization space. As he mentioned, Nora, my co-founder and a physician, have been working through this kind of remote care and virtual care modality over the last few years with very, very strong clinical results and adoption in the industry, largely in innovation communities and in other areas with clinical relevance. And as we looked at the market and as we looked at the opportunity, it became clear to us that the opportunity was not only expanding, particularly with what happened in healthcare across the board with COVID-19 and just the transformation of the space as a whole. But also just in terms of remote care and the growth within that space that was happening, and put in motion even prior to the pandemic. What we've seen over the last 18 months is that this is a huge land grab, and speed to market and speed to really become a trusted source in the market is very, very important. And we felt that it was an opportune time to bring James specifically on in this capacity, given how seasoned he is in this space.
Yeah, it seems like it's a great match on both sides. So it's I'm happy for you and the team. You mentioned COVID-19, and I want to go back to that real quick because one of the things I wanted to go through today was basically how did remote patient monitoring solutions like Veta Health stand up to the challenges that were brought on by the pandemic over the last year. And we're not out of it yet, but I would, some would say we're in a better, obviously, position than we were this time a year ago.
Yeah. From our perspective, virtual care, remote care has been around for a long time. We saw very low adoption of telehealth prior to the pandemic, and that increased, depending on the facility or the institution, anywhere between 50 and 175 fold in terms of volume of telehealth visits. That's a huge number, of course, but I think really what is most impactful and a really important takeaway from that is patient and provider willingness to adopt these technologies as part of their mainstream workflows has changed dramatically in the last 18 months. And so what we're looking at is, remote care and remote patient monitoring as a risk mitigation strategy to cater to those 4 in 10 adults that didn't seek care during the pandemic because they were too afraid, or to really cater to the patients who are saying, I would be willing to switch doctors who, if they provide specialized monitoring or remote monitoring devices. And that market acceptance, I think, is one of the biggest changes that we've seen in the last 18 months.
What I'd be interested in kind of diving into off of that is, so when we look at remote patient monitoring has been around for a while now, but it seems like over the last 2-3 years, it's become even more of a hot topic. I say that because it was a couple of years ago, you would put a hashtag on LinkedIn or some other social media channel, and you might not get anything. And now you do RPM or remote patient monitoring, and you'll get thousands. One of the things I want to kind of shift focus to with you, James, is can you speak to how these RPM solutions are basically covered by insurance, Medicare, Medicaid, and what expansion acceptance have you seen of billing codes?
Sure. So you're absolutely right, Jared, in thinking around the concepts of remote patient monitoring and how they overlay in the clinical workflow and the delivery model has been around for quite some time. The adoption curve for those has been really slow. There's a number of factors behind that, predominantly for the compliance reasons when it comes to adherence and commitment to working through those care channels on a patient perspective is typically very low. The patients are relatively inexperienced when it comes to digital care and usually don't want to interfere with their day-to-day routines. They don't want to feel like they have to do something that they weren't used to doing. Consequently, providers and thinking about their reimbursement parity structure was not very highly motivational in their favor. So CMS started to look at these situations and understand, hey, the cost avoidance metrics and the models that are in place have been justified over and over and again. There just hasn't been adopted at large scale. So as we start to look through what the insurance models looks like, it has a significant effect on the adoption and uptake, particularly on the provider side. So if you think about it now, going from CMS only reimbursing for a couple of very specific clinical use cases to these wide open environments now in remote environments where patients that essentially can be deployed a chronic illness or considered a chronic illness patients without even a clear diagnosis on this has an opportunity to be leverage a solution that can treat them in the environments in their home-based environments. So if you look at private insurance, historically, private insurance didn't reimburse for this, and more private insurance is starting to add this to plan design to allow for to be a covered benefit for patients to receive this type of care. CMS has dedicated some specific reimbursement codes for Medicare and Medicare Advantage patients that can be fully covered as far as their coverage models are concerned. And more than half of the states in the country have their own plan across Medicare benefits or Medicare plan or Medicaid benefits for plan design that have coverage models as well. So as we see more increased usage and more demonstrated cases of clinical outcome metrics and the benefits of cost avoidance, there seems to be a significant amount of uptake and usage for both patients and providers, which will inform and affect the amount of reimbursement models that are carried through.
And thank you for that, James. Appreciate that. I continue to love to see how the space continues to grow. It's great seeing some of the new codes that are coming out, and it seems like even with with Medicare and Medicaid, you're seeing them put out more and more feedback, and there's always some sort of article or something tied with them in RPM, more so than in years previously. You mentioned something in there about chronic conditions within your response, and I want to kind of shift focus to Tanvi real quick, because there was something I did want to ask you in regards to that. Why would you, in your opinion, why is Veta Health a good fit for patients with chronic conditions?
So without going into our full sales pitch, we were really designed, unlike most remote care platforms out there, from the patient perspective backwards. And so really core to what we offer is a very, very deep personalization strategy. We have to recognize that no two patients, as an industry, we have to recognize, and I think we do this very well in-person clinical practice, no two patients are alike. Their needs are vastly different, even if they both have the same diagnosis of hypertension or heart failure. What their abilities and their goals are also very different. The type of education, the type of messaging that really resonates with them is different. So everything that we've done at Veta Health is to work from that patient experience perspective backwards, of how do we really meaningfully engage patients in the technology medium that they're most comfortable with. For some, it's SMS. For some, it's apps. For some, it's email. And for some, it's, traditional telephonic communication, and we offer that as well. And within that, the information that we're gathering from the patient, both passively and actively, through devices, through understanding what type of educational content they're engaging with, through survey responses, and then any data that we're getting from the clinical record, we are actually driving more and more personalization within that digital care experience for the patient to help them meet their goals.
Thank you for that. And I'll tell you, I love that you said, without going into our sales pitch. Those are my favorite type of people to deal with, when you can talk about what you're doing. And I set you up for that too. So if anyone, whenever I ask someone that, you're allowed to go into your sales pitch, whatever you want to do, because it's when we have these conversations, it's great to hear from you. You're experts in the field, but I also like to shine that light on your organization, because you are doing some really cool things in the space, and people deserve to know about that.
Well, for the opportunity.
Absolutely. Well, as we'll start to wrap up in the next few minutes, but I wanted to ask at least one or two more things before we kind of go to final thoughts. And this one will shift basically back to James. Have you seen provider and patient behavior change as there's more awareness around these digital health solutions that exist in the space today?
Yeah, there's definitely a shift. You obviously can recognize that there's a significant spotlight on consumer awareness around telemedicine or digital care or remote management, and selection of choices that those patients now have. And Tanvi spoke to that a little bit more with regards to the COVID pandemic and what that effect was caused as a result of the pandemic. So there's a significant shift in understanding what these things can do to affect the workflow management and the engagement strategies of these patients in environments where they may have not have ever received care in the past, or maybe never considered receiving care in the past. So you start to think about, all right, I'm a patient. I'm trying to interface with healthcare. I recognize that I'm concerned around being infected by simply just going to the doctor anymore. What are my options that are available to me that can be offered either in digital environments or some other form of communication that I may have not even considered in the past? So the awareness is significant, and that awareness drives informed challenges or changes within the provider space, and that they now have to adopt to that workflow. So patients and providers can now collaborate and understand what that looks like and drive towards better and more increased outcome metrics, but also a better patient engagement and experience. Tanvi really spoke to that earlier, in that our organization is centralized around the patient experience, and the goal around really being patient centric is our focus. So patients and providers likely are in lockstep with what that looks like moving forward, and now are making advancements in their workflow model to ensure that that patient experience is much more defined and reasonable when it comes to how they interface with healthcare.
Thank you for that. Yeah, it's I've always been a huge fan of what everyone's really building in digital health. So it's certainly great to see. I mean, you used to go to a family dinner or something, you even mentioned telehealth, right? No one even knew what the heck you were talking about a couple of years ago. And now it's like, oh yeah, I've used this company. Or now once we're starting to see even people understand remote patient monitoring, and that's pretty cool at the dinner table, right? When you bring that up in conversation. But that was like non-existent a couple of years ago for patients. They didn't even know what the heck that was, most of them. So it's certainly interesting to see how things continue to grow.
Absolutely.
Well, I would like to hear just one before we wrap up here, really what's next for the company. And that could be from either of you or both of you. And again, I hope we can have you on again real soon to chat about some more issues.
Tanvi, go ahead.
I was going to say, go ahead.
So as far as what's next for our organization, I think we hinted at this a little bit around really ramping up our commercialization efforts as a company. We have a global presence, which is a unique situation in many of these organizations who are considering opening up their services in the domestic U.S. So it's a unique differentiator that we offer. We also offer this long-standing credibility of sustained and repeated outcomes over the previous 5 years that other organizations can't typically compete against. But really where our true differentiators are built around that patient-centric engagement strategy and an ecosystem model that helps to bridge the chasms or the challenges of engagement and the workflow delivery model that may have not been seen in the past. So for us, what will be coming in the future is a broad-based, I would say, awareness around what true good or best practices look like when it comes to remote management and chronic illness management in remote environments, and really setting the bar at a much higher level than those point solutions that exist on the marketplace today that are derived from either just technological differentiators or simple thought process differentiators and are unable to put the whole package together. So I think that will be really the true advancement from an engagement standpoint, as well as focusing on that patient strategy and an informed decision-making process that personalizes the process for them, so they don't feel like this is a off-the-shelf solution that is a one-size-fits-all, because healthcare is not ever one-size-fits-all.
Absolutely. Absolutely. Well, again, thank you both for joining me on the podcast today. Look forward to having you on again real soon, and wish you all the best of luck and Veta Health. Love what you're building. And, maybe around the holidays, remote patient monitoring will be discussed at the family table for those that don't know you, right?
Thank you.
Always a pleasure. All right. Talk soon.
Thank you, Jared.
Thanks, Jared.